This medication, Dual Action Complete, contains a combination of 3 medications that work together to treat heartburn and other symptoms caused by excess stomach acid, such as acid indigestion. Famotidine is a medication that blocks acid release in the stomach, helping to prevent heartburn and acid indigestion from recurring. Additionally, the antacids calcium carbonate and magnesium hydroxide work quickly to lower acid in the stomach and provide relief from heartburn. It is recommended to take Dual Action Complete as directed by a healthcare professional. Generally, the recommended dosage is 1 tablet as needed, but it is important to follow the specific instructions on the label. It is best to take this medication with a full glass of water, and it can be taken with or without food. When it comes to using Dual Action Complete, it's important to chew 1 tablet completely and swallow it as needed to stop or prevent the symptoms of heartburn and indigestion. Make sure not to swallow the tablets whole. You should not take more than 2 tablets within 24 hours, and always follow the directions on the product package. If you have any questions, it's best to ask your doctor or pharmacist for guidance. It's also important to note that this product contains an antacid which may react with other medications, affecting their absorption in your body. It's a good idea to talk with your doctor or pharmacist about how to schedule your medications to prevent this problem. If you find that your symptoms continue or do not improve after taking this medication for 14 days, it's important to stop taking it and call your doctor promptly. Also, do not take this medicine for more than 14 days in a row without consulting your doctor. As always, it's best to follow your doctor's recommendations for the best results. Side effects of Dual Action Complete may include diarrhea, headache, constipation, or stomach cramps. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist. If your doctor has prescribed this medication for you, it is because they have determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, it is important to contact your doctor immediately if you experience any serious side effects, such as easy bruising or bleeding, signs of infection, or changes in mental/mood. Seek medical help immediately if you experience very serious side effects, including irregular heartbeat, severe dizziness, fainting, or seizure. While rare, a serious allergic reaction to this drug is possible. If you notice symptoms such as rash, swelling, or trouble breathing, seek medical help immediately. This is not an exhaustive list of possible side effects. If you notice any other effects, contact your doctor or pharmacist for further guidance. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Dual Action Complete, it's important to talk to your doctor or pharmacist if you have any allergies to famotidine, other H2 blockers, or antacids containing calcium/magnesium. This product may contain inactive ingredients that can cause allergic reactions or other problems, so be sure to discuss any concerns with your pharmacist. If you have kidney problems, liver problems, or other stomach issues, it's essential to consult your doctor or pharmacist before using this product. Some symptoms could be signs of a more serious condition, so seek medical help right away if you experience certain symptoms like heartburn with lightheadedness, chest pain, or unexplained weight loss. Before self-treating with this medication, seek medical help if you have trouble swallowing food, bloody vomit, black stools, frequent chest pain, or stomach pain. It's also important to note that this medication should not be used in children younger than 12 unless directed by a doctor, and older adults may be more sensitive to the side effects. During pregnancy, use this medication only when clearly needed and talk to your doctor about the risks and benefits. If you are breastfeeding, consult your doctor before using Dual Action Complete. It's important to be aware of potential drug interactions when taking Dual Action Complete. This medication may change how other medications work or increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Dual Action Complete include certain antibiotics, calcium channel blockers, digoxin, phosphate supplements, and thyroid medicine. It's also important to note that some products need stomach acid to be properly absorbed by the body, and since famotidine decreases stomach acid, it may change how well these products work. These products include certain antifungals, as well as medications like atazanavir and pazopanib. And be sure not to take this medication with other products that contain famotidine or other H2 blockers, such as cimetidine, nizatidine, or ranitidine. Always consult your doctor or pharmacist if you have any concerns about potential drug interactions. If someone has taken too much dual-action complete and experiences severe symptoms such as fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. If you want the dual-action complete medication to work effectively, consider making some lifestyle changes. This includes participating in stress reduction programs, cutting back on smoking and alcohol consumption, and making dietary changes such as avoiding caffeine and certain spices. It's important to discuss with your doctor or pharmacist about these lifestyle changes and how they might benefit you. Sorry, I cannot fulfill your request. Be sure to store dual action complete at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to getting rid of any leftover medication, don't flush it down the toilet or pour it into a drain unless directed to do so. Instead, be sure to properly discard the product once it has expired or is no longer needed. You can consult with your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.